What if you are not broken? When life becomes difficult, many people do not simply think, "I am struggling." They begin to wonder, "What is wrong with me?" But pain is not always evidence that something is fundamentally wrong with who you are. Sadness, anxiety, grief, anger, shame, loneliness, confusion, and overwhelm are part of being human. These experiences can be deeply painful, but their presence alone does not mean that a person is defective, weak, or disordered. Many people learn to hide how difficult life feels. Our culture often rewards productivity, independence, composure, and emotional control. As a result, ordinary suffering can begin to feel private, embarrassing, or unacceptable. The growing use of clinical language has brought important benefits. It can validate suffering, reduce silence, guide treatment, support access to services, and help people realize that they are not alone. Therapy, medication, diagnosis, and professional care can all be valuable. The problem begins when the label becomes the whole story. Every painful emotion becomes a symptom. Every struggle becomes a disorder. A diagnosis that was intended to describe an experience begins to define the person. But you are not just anxious, depressed, traumatized, or overwhelmed. You are a whole life in context. You are biology, history, relationships, culture, loss, strength, values, protective strategies, unmet needs, hopes, and possibilities. To pathologize is to interpret a human experience primarily as evidence of abnormality, defect, or illness. It happens when the chart, category, or diagnosis becomes more important than understanding the actual person. Sadness after loss, anxiety during uncertainty, anger after mistreatment, or shutdown after chronic stress may be painful and worthy of care, but these reactions can also make sense in response to what a person has experienced. Distress deserves attention, but attention does not require condemnation. We can take suffering seriously without reducing someone to it. We can acknowledge that something is wrong in a person's life without concluding that the person is wrong. A diagnosis is a tool. It can organize confusing symptoms, guide evidence-based treatment, support accommodations, provide insurance coverage, and connect someone with useful resources. A helpful diagnosis opens doors. It should not close down identity. Description should not become identity. There is a meaningful difference between saying, "I experience anxiety," and saying, "I am an anxious person." One describes a pattern. The other can begin to feel like a permanent definition. Struggle is often contextual rather than characterological. Emotional difficulty does not necessarily reflect laziness, weakness, immaturity, or a lack of willpower. Human beings respond to what they have been carrying. Sleep loss, financial pressure, grief, conflict, health problems, isolation, discrimination, workload, trauma, and unrealistic expectations can accumulate. The nervous system does not experience these pressures as background details. It carries the load. Sometimes the nervous system adapts through vigilance, withdrawal, irritability, perfectionism, people-pleasing, avoidance, overthinking, or shutdown. These responses may become painful or limiting, but many began as attempts to survive, stay safe, belong, or regain control. Instead of moving immediately toward judgment, we can become curious. What has my nervous system been carrying? What does this reaction make sense in response to? What need, fear, or protection might be underneath it? Mental health does not exist outside culture. Families and communities differ in how they understand grief, loyalty, emotional expression, spiritual struggle, trauma, injustice, and help-seeking. A reaction cannot be fully understood when it is separated from its cultural and social context. Trauma-informed care asks a different question. Rather than asking only "what is wrong with you," it asks "what happened to you, what helped you survive, and what kind of support would help now?" Avoidance may be an attempt to stay safe. Anger may signal a violated boundary. Numbness may be a protective shutdown after prolonged overwhelm. Anxiety may reflect a nervous system monitoring for danger. Understanding the purpose of a reaction does not excuse every behavior, but it gives us a more accurate place from which to change it. Difference does not automatically mean defect. Variations in attention, sensory processing, communication, learning, and social experience may create genuine challenges, but people often need support, accommodations, and more suitable environments rather than pressure to erase who they are. Imagine someone who becomes tense whenever a supervisor sends a short email. They reread it repeatedly, worry that they have made a mistake, and stay late trying to correct problems that may not exist. Their first thought is, did I do something wrong? By the time they leave work, they are exhausted and frustrated with themselves. They tell themselves they are too sensitive, that they always ruin things, and that they cannot handle normal life. An old protective system is activating, but they experience it as a personal failure. The reaction has a history. They grew up in a home where small mistakes often led to criticism. As a child, they learned to monitor tone, facial expressions, and changes in mood. That sensitivity helped them stay prepared. The past now informs the present. Situations that resemble earlier criticism can activate the nervous system even when the current danger is much lower. The anxiety is real, but it is not proof that the person is defective. When the person begins saying, "A protective part of me is scared," instead of "I am broken," something changes. They may still need therapy, coping skills, environmental changes, or medication, but they are no longer approaching the work from shame. De-pathologizing involves several important language shifts. What is wrong with me becomes what is happening in me. This is who I am becomes this is a pattern I experience. I need to fix myself becomes I need understanding and support. And symptoms are enemies becomes symptoms may also be signals. The grammar of our inner dialogue matters. Instead of saying I am anxious, we might say anxiety is showing up right now. Instead of I am lazy, we might say something in my system is having difficulty initiating. This is not empty positivity. It is more precise language. Before judging yourself, add context. Consider sleep, stress, workload, relationships, health, finances, grief, sensory overload, isolation, and the demands of your environment. Ask, given what I have been carrying, how does this reaction make sense? Kindness and responsibility can coexist. Self-compassion does not mean avoiding accountability. It means naming the pain, recognizing that struggle is part of being human, and asking, what is the next kind and responsible step? Healing is not only internal. Sometimes people need better boundaries, safer relationships, more rest, workplace accommodations, reduced sensory overload, community connection, medical care, or protection from ongoing harm. The environment may need to change too. Professional support matters when distress is persistent, worsening, impairing daily life, affecting relationships, disrupting sleep or appetite, increasing substance use, or creating thoughts of self-harm. De-pathologizing is not the opposite of treatment. The goal is not to say nothing is wrong. The goal is to say something is happening and I deserve support without reducing myself to it. Pain can be real without becoming a verdict on your worth. You are more than the struggle. A diagnosis may explain a pattern, but it does not explain your entire life. A painful reaction may reveal a wound, but it does not erase your strengths. A difficult season may shape you, but it does not define your worth. A more compassionate question is, what is happening in me? What has shaped it? And what would help? That question creates space for understanding, responsibility, treatment, support, and change. Healing may begin not by becoming someone completely new, but by seeing yourself more fully. You can take your symptoms seriously without turning them into your identity. You can seek help without seeing yourself as defective. You are more than a diagnosis. Take the pain seriously, but do not reduce yourself to it. Psychoeducation can support understanding, but it is not a substitute for individualized mental health care.